we are going to talk about what is abdominal separation. So you'll gain a deep understanding of what abdominal separation actually is and some of the myths around it. So the abdominal separation has happened because during pregnancy we have a very different hormone profile that make that connective tissue stretch because of the physical pressure pushing against it. So the baby physically growing is pushing that connective tissue out and open to make room for the baby. That has caused a stretch in that linea alba. I'm sure you can see how this stretch happens. So on the left and superimposed on the pregnant stomach, we have a normal sized abdomen with all those pelvic organs. When the baby grows, it also needs to make room for the baby, and that stretch happens coming out, pushing the abs apart to make room. So you can see it from the front. Here is where it would open. So that line down the middle is picturing that linea alba, as it's the weakest point and the part where all that relaxin and hormone tissues are going to make relax. That is where it's going to separate open, and we'll see that separation or diastasis between the muscles. One thing that I think it is important for everyone to know is that there is a gap between everyone's abdominal muscles. That's what the linea alba is naturally. It just becomes more separated and relaxed during pregnancy. So that connective tissue is widening and thinning out, and then postpartum it comes back together. Sometimes it doesn't come back together completely. So I picked these three lovely gentlemen here because I have a good feeling that none of them have given birth. We can see in all of these three males that there's uneven and openings of the linea alba in different parts of their abdomen. Some towards the top, some towards the bottom, and some in the middle. So there is a normal and typical amount of gap between the two sides of the abdominal muscles. But the million-dollar question is how much, where, and what's the difference postpartum? So a nice little fun fact for you is that 100% of women have diastasis or DRAM post-birth. From there, the prevalence or how many people have it decreases to 52% at 6 weeks postpartum. So that's about half the people will have it then, and continues to decrease to about 40% at 6 months. As lots and lots of women will have DRAM for their entire life, whether it bothers you or not will be whether you treat it or not. You might already be thinking, doesn't matter if I had a C-section or vaginal birth, and we're going to go through that next.